Hello dear viewers, welcome to my channel where I share tips and advice on parenting. In today's video, I'm going to talk about some of the things you need to know about your newborn baby's health and development. If you're new here, please consider subscribing and hitting the bell icon to get notified of my future videos. And if you find this video helpful, please give it a thumbs up and leave a comment below. I'd love to hear from you. So, let's get started. One of the first things you need to know is your baby's blood group. If you have a negative Rh factor, which means you don't have a certain protein on your red blood cells, you might have a different blood type from your baby. This can cause problems if your baby's blood mixes with yours during pregnancy or delivery. To prevent this, your doctor will give you a shot of immune globulin during your pregnancy and after birth. They will also take some blood from the umbilical cord to check your baby's blood type and see if they need any treatment. Don't worry, this is a routine procedure and it's very safe for you and your baby. Another thing you need to know is how much your baby sleeps. You might be surprised to learn that your baby will sleep a lot in the first few days of their life. They might sleep for up to 6 hours after their first feed, and then for more than half of the day. This is normal and it's good for their growth and development. But it doesn't mean you can sleep as much as they do. You still need to feed them every 2 to 3 hours, even at night, to make sure they get enough nutrition and hydration. You also need to keep an eye on their temperature and make sure they're not too hot or too cold. You can do this by dressing them in 1 or 2 layers more than you, and covering their head with a hat. You can also check their chest or back with your hand to feel if they're comfortable. One of the most important tests your baby will have after birth is the Apgar score. This is a quick assessment of how well your baby is adjusting to life outside the womb. It measures 5 things: heart rate, breathing, color, muscle tone, and reflexes. The test is done at 1 minute and 5 minutes after birth, while your baby is on your chest. Sometimes it's repeated at 10 minutes if there are any concerns. The score ranges from 0 to 10, with 10 being the best. A score of 7 or above means your baby is doing well and doesn't need any special care. The Apgar score is not a test of your baby's intelligence or future health. It's just a way of checking how they're coping with the transition from the womb to the world. Now, let's talk about how your baby senses the world around them. Your baby has been listening to your voice for the last half of your pregnancy, and they will recognize it when you speak to them after birth. They will also recognize your partner's voice, or anyone else who has been talking to them regularly. Your baby will feel secure and comforted when they hear your voices, and they might even turn their head towards you. They will also hear your heartbeat, which is familiar to them from the womb. Your baby's vision is not very clear at birth, but they can focus on your face from about 12 inches away. This is the perfect distance for cuddling and bonding with your baby. Your baby will make eye contact with you and try to match your expressions. Your baby will also smell and taste the world around them. They will smell and taste the amniotic fluid and your colostrum, which is the first milk you produce. These have a similar flavor and help your baby to latch on and breastfeed. Your baby will also prefer your smell over anyone else's, and they will recognize you by your scent. This is why it's good to avoid using strong perfumes or lotions, and to stay away from cigarette smoke. Lastly, let's talk about your baby's urine and poop. Within the first 24 hours, your baby will probably pee and poop at least once. Their first poop is called meconium, and it's black and sticky. This is normal, and it means your baby is getting rid of the waste they accumulated in the womb. Your baby's poop will change color and consistency over the next few days, depending on how they're fed. If you breastfeed, their poop will be yellow and runny, and it might have some seeds or curds in it. If you formula feed, their poop will be darker and firmer, and it might have a stronger smell. Your baby's pee should be clear or pale yellow, and it should not have any blood or mucus in it. You should change your baby's diaper frequently to keep them clean and dry, and to prevent diaper rash. So these are some of the things you need to know about your newborn baby. I hope you found this video helpful and informative. If you have any questions or comments, please leave them below, and I'll try to answer them. Thank you for watching, and I'll see you in the next video.